And in order for us to do that, we had to be invited, so we were there as part of the U.S. Department of Health and Human Services Incident Response Coordination Team, or IRCT. I'm also going to talk about the Federal Public Health Mission support directly to the Puerto Rico Department of Health, and my counterpart, Graciela, is here. She's going to talk about the local aspect of that. And talk about some challenges and opportunities for addressing some of the regional concerns for hurricanes in Puerto Rico and the Virgin Islands, because over there, we're completely isolated with pretty much on our own until help arrives. So our public health assessment team initially, like I mentioned before, was initially deployed there to support the Hurricane Irma response. So it was a small footprint of about 7 people with different specialties in public health, health communications, AP surveillance, environmental health, emergency operations, and so on. So we were part of the HHS team deployed. When we were there, we assessed Puerto Rico, and then we were redeployed to the Virgin Islands to conduct an assessment there. In the middle of that assessment, Hurricane Maria formed, developed, and we were ordered to leave the Virgin Islands and to redeploy back to Puerto Rico for shelter in place. After we woke up next day, after Maria, we realized that we needed additional resources in Puerto Rico. And as a result of that increase in staff, we established a full public health branch. So we went from a team to a full branch. So this is the organization of the public health branch. And as you can see, we had the leadership, the public health branch chief. I was the public health branch chief for 2 months during the response phase. I have a deputy, we have a cadre of FEMA LNOs. FEMA divided Puerto Rican branches, so we assign public health LNOs to those areas so they can watch and keep an eye on the public health issues. We have our operations branch that consisted in teams in Puerto Rico and the USBI. Eventually, during the response, we split it, so we were only working in Puerto Rico. There was a different team working in the USBI. Well, we established several teams, including general public health, basically the stuff we do every day, but under disaster conditions. And we have health communications teams, we have EPI and health assessments, health needs assessment teams, and restoration of services team, which is a new modality that we initiated in Puerto Rico, and I'm going to explain later about what that is. All our admin, logistics, and plans support interface was to HHS, to the HHS Incident Response Coordination Team leadership. So this was our first mission. And you say, why we have this technology using paper? It's because we didn't have any power and computers were run out of power, so we were working with paper and pencil. And this is our first major ask to the federal authorities from the Puerto Rico Department of Health to help in conducting healthcare facility assessments. So we completed we assessed about 97% of the healthcare facilities in Puerto Rico and 87% of the health centers there. We coordinated our mission support with the Department of Defense. We rode a lot in helicopters. Why? Because a lot of these facilities were located in really restricted and isolated areas where there was no access to roads. So we had to be dropping with the team, going and do the assessments and get out. And we also, during the initial phase, the federal part requested us to travel with law enforcement during the initial few days or a couple of weeks. Our public health assessment teams did a great work there. They were in charge of assessing water systems in key facilities, like the medical center area. That was one of the areas where they focused on. The disaster shelters, federal medical stations, billeting for responders, DOE military facilities. They did assessments, needs assessments for vector surveillance and vector control. And then, like I mentioned, served as liaisons for the Federal Emergency Management Agency branches. Our health surveillance team initiated syndromic surveillance system there using several facilities from the Department of Defense, Veterans Affairs, and the National Disaster Medical System clinics in different parts of the island. We also conducted an isolated community assessment mission, and that was, when they were doing these aerial assessments, they identified pockets where there were communities completely isolated. Their norm was to drop there, there's some food and water, but we offered that we can do public health assessments there. So we use follow the model of Casper's. How many of you are familiar with Casper's community assessment of public health emergency response? And we did kind of mini Casper's in there to identify some of the immediate needs. These things were deployed by air and ground. Eventually, some of those became open, and we were focused more on basic needs and immediate health concerns, like people that were injured, people that have any kind of acute illness. We were looking for those. Our mission was supported by DOD and the Department of Homeland Security. Health communications on any disaster is a big priority, especially in Puerto Rico, where people were drinking water that was not up for human consumption. We needed to do a lot of the health communications on how to disinfect the water, how to use chlorine pills, and all that. We also have managed rumor control. There were rumors of going on, and my counterpart from the Department of Health can test to that about cholera and shelters, and we were like, yes, 2 cases of cholera and shelter there. Really? Okay, so we need to deal with all those issues on top of everything else that was going on. So we developed audience-specific materials, not just for the public, but also for doctors. Many of you know that there was a situation going on with leptospirosis there. So we needed to educate the doctors. So I had to, 3 cases of leptospirosis had to be suspicious about those cases and on what they needed to collect in order to be able to send those specimens for analysis. And also, with the lack of Spanish speakers, we took a lot of these health communicators with us in the missions to the isolated community areas because they spoke the language, so we use them there. The restoration of services team, like I mentioned, this is an initiative in which we work with environmental health officers and engineers to put together teams to go and do assessments of facilities. Then they return back to those facilities to do cost damage assessments. And for that, the engineers are good doing that, and they use a specialized software to calculate costs. Why? Because this information is necessary, so we can put a bill in the hands of FEMA or whoever to say, okay, this is what we need to bring this facility operational, and this is what we might need to bring this facility back alive. Okay, so that's very important because in public health, we need to bring those services. These are life-saving, life-sustaining services that need to be online so we can test. In Puerto Rico, our labs were down. So we have, the lab water was down, the food labs, the milk water was down, the leptospirosis lab, the infectious disease labs were down. So, we needed to bring those facilities back. We were sending a lot of specimens to CDC for testing, but our goal was to bring those facilities back. So we cooperated and we worked together with Army Corps of Engineers, with the Association of Public Health Labs, FEMA, and the Centers for Disease Control laboratory experts that came to help us with assessments there. So basically, our agencies demonstrate a unity and effort of cooperation. We work together very closely with the FEMA, DOD, the Department of Homeland Security, and our counterparts from the Department of Health. We have some challenges coordinating these assessments, and this is well documented in the literature. It happened in Puerto Rico, where we go there with the official entity to these assessments, and there were all kinds of groups there doing assessment. We face safety hazards and communications challenges. Once things went out in the metro area, we didn't have any communications with them until they came back at night in the middle of the curfew that was instituted by the government, and also language issues. We ask for assets, resources. They send us people. They say, "How's your Spanish? I can speak in Spanish." Okay, well, I can't send you by yourself to go to the community and talk to the community about water or safety issues. So you need to go with a translator or something. So this Caribbean region is a hotspot. You know, we always under the threat of natural disasters for us. We're now planning for future earthquakes. So it's always a constant threat there. So basically we need to make sure that the logistical and resources, the human elements, are there. We need help because these isolation challenges that we have, they need to be considering future planning for disasters. And we also need to think about, what if we are in our own, like we did Maria, for a while. So, we should start thinking about how to build a coalition or a regional coordination and support, element there that can help us, initiate at least the basic needs assessments that need to take place initially after a disaster until, we get the army in there and the big guns down in Puerto Rico to help us. So basically that concludes my presentation, and thank you for your time.
Great, thanks very much, Dr. Cruz. I think we'll hold questions to the end and we'll get all the panelists up in front for discussion. So our second speaker is Dr. Amy Nitza. Dr. Nitza is the director of the Institute for Disaster Mental Health at SUNY-New Paltz. She's a psychologist who specializes in providing mental health training in academic and non-academic settings, both nationally and internationally, with an emphasis on disaster mental health and trauma recovery. She's currently collaborating with UNICEF USA to develop and implement a program of mental health support for children impacted by Hurricane Maria in Puerto Rico. She's the author and editor of numerous publications on disaster mental health, and she will be talking to us about their experience in Puerto Rico.
Good afternoon. Can you hear? Is this okay? Okay. Hi, Sam. First I want to thank the organizers of RISE for putting on this massive, giant, impressive show, and also to Dr. Lin for inviting me to participate in this panel. So what I'm going to be talking to you about today is presenting the results of a survey that we did of teachers across the island that we conducted in August this year. So one of the things that we know in terms of thinking about long-term mental health recovery is that schools play a really important role. They are able to provide a lot of what we know are protective factors in supporting children's mental health, particularly around offering stability and routine and cohesion and connection, which we know are really key to children's support. However, at the same time, risk factor, on top of the disaster itself, the rate of school closures and the rate of out-migration introduced risk factors around the lack of social support and the lack of connection and the disruption in children's lives and routines that we know to be risk factors. And so funding from UNICEF USA made possible the development of a program of training and support for teachers. And so as a piece of the development of that program, we wanted to know what teachers thought they were dealing with. So we were, so this isn't, just to be clear, this is a survey of teachers' perceptions of what they think is happening with their students 2 years out. Okay. So the inclusion criteria here are that the people needed to be employed as classroom teachers in public schools in Puerto Rico, both at the time of the hurricane and at the time of the survey, which was in August of this year. So we had a total of 6,375 teachers who met that criteria. And I put this list of variables up here so that you can see. What I don't have up here is that these are really distributed almost equally throughout all 8 regions, all 8 education regions. of the island. But the other thing I want to point out is that most of the teachers who responded, if you look at the very last row, are teachers with greater than 10 years experience. So these are teachers who have, this was not their first rodeo, so to speak. I don't know, we say that in Kansas. I don't know if people say that elsewhere. Okay. Okay, so we distributed a Qualtrics survey, a link to a Qualtrics survey to the directors of all the schools through the Department of Education. And the directors were asked to give teachers the opportunity to complete this survey during a professional development day that happened in August. So it was August 5th or 6th or something this year, so it was just short of 2 years after. We don't know, we can't calculate a response rate because we don't know how many teachers, how many directors actually distributed the link. But I believe that the number of teachers employed on that day was that number, 25,882 or something like that. So what we have with that 6,000 is 24.6% of the total population of interest. So this is what we asked about. So this is a variable that we created, and I see my colleague Hassan is here somewhere. Can you raise your hand? She helped me immensely with this project. So in terms of students, we asked about what the teachers thought kids were facing at this time in terms of lack of access to basic needs and exposure to external stressors, as well as their perception of how kids in their classroom now are doing as compared to before the storm on academic performance, as well as cognitive, emotional, and behavioral functioning and overall attitude. And how we asked about that was something like, are they feeling more hopeless, more apathy, more hopeful, more meaning in their lives, those kind of things. But we also wanted to know how the teachers themselves were doing. We did some focus groups before we conducted this survey, and we went in sort of naively asking, what do your kids need, what are you seeing? And this was probably a year and a half out after the storm, and before the teachers could ask those questions, they still needed to tell us about the sound of the wind on the day that the hurricane hit, or how long they had to stand in line for gas before they could get to school, and then they had to get home to help their mother-in-law with the respirator machine, or whatever the situation was. And so before we even got into this, we knew we have to start with teachers and supporting teachers if we're going to be able to help them support the kids. So we asked about the teachers' personal and professional stress and their level of job satisfaction, how prepared they feel to deal with whatever challenges they've reported here, and what additional resources they thought they needed. We have a lot of data, so what I'm going to present to you are just some of the highlights that I think are the most important from the quantitative data. We also have so much qualitative data. We said, what else do you need to know? And we just have so many. It's going to take us a really long time to get through all the qualitative data. But what stands out here is the amount of family separation, which we know from other data beyond this survey as well, but teachers are reporting the same thing that we're seeing in other quantitative data from other sources around what percent of kids have experienced family separation. So if you combine that family separation data with the death in the family data, kids are really experiencing big disruptions in their lives at home. And this is the data where we ask how teachers thought they were doing, how teachers thought their kids were doing in their classrooms now as compared to how kids were doing before the storm. Now, clearly they're not teaching the same, unless they're in a Waldorf school or something, they're not teaching the same kids, but just in general. So again, this is just their perceptions, right, of what they think is different. But these numbers are really big. So 72% reported overall that that students in their class now are doing worse academically, and 69% cognitively, and almost all above 50%, right, except the attitude change. That quote there is just an exemplar. They live in fear of another hurricane, just like or worse than Maria. Definitely the behavior has worsened, and the concentration. So the other thing that really stands out here is we looked at this, we broke this up by region of Department of Education region in the country. No significant differences. None of the variables that we assessed for demographically predicted differences in this, except the length of time their schools were closed. So the length of time that schools were closed predicted teachers' perceptions of change in academic performance. So schools that were closed, teachers in schools that were closed less than a month predicted or reported less decrease in functioning across the board than teachers in schools that were closed for more than a month. I think I explained that right. Does that make sense? Okay. So, and again, we know this to be true from the literature in general, that kids need to get back to their routine. They need a sense of structure and regularity that schools can provide. At the same time, I want to draw your attention to these quotes. So now I'm in the how teachers reported their own distress. So that second quote there, teachers should never be pressured to return to their workplace soon after a serious event. Teachers have their own problems to deal with, right? So that's a real stuck place to be when we know that kids need to get back to school, but we also know that teachers really need time to recover themselves. So how do we best support teachers in those circumstances? So this is, again, across the board, teachers report of how they're doing. So a quarter report that they don't feel equipped to deal with what challenges they're seeing with their students, and then their levels of professional and personal distress and decreased job satisfaction since the hurricane. Okay, so we know students have faced major disruptions, which is a risk factor. We know that teachers perceive that their students are struggling in all areas of functioning, particularly academically and cognitively, and teachers are trying to figure out how to do this while struggling with their own challenges still 2 years out. The other thing that just really stood out to us about this data is how consistent this were across regions. This data was across regions and across grade levels, demonstrating the ubiquitous nature of this storm and its impact. And so I didn't present the qualitative data here, but from what we've read so far, the themes are around frustration with the government and frustration with the government writ large, not, just the government, and with parents. They don't feel supported, is really the story. Mike, I think that what we tapped into, I don't have a way of demonstrating this, but I think we tapped into pre-existing frustration before the storm. And now, between the school closures and the turnover at the PRD East since the storm. So I think just saying, what do you want us to know, gave them a chance to say whatever was they felt they were struggling with. And so I think that what we need to do, well, first of all, what we need to do is support the teachers themselves. I actually pitched to UNICEF USA, let's do interventions for actual group support intervention for teachers. They're not quite there yet, and they're thinking about that, so I haven't given up. And we need to take into account the contextual factors. Teachers aren't working in a vacuum. And so how can we give them a voice and give them a space to feel supported and feel heard so that they can in turn give that experience to their kids. I think that's it. Thank you very much.
Great, thank you. So our next speaker is Graciela Malavé. Ms. Malavé is an exercise evaluation manager and certified master exercise practitioner for the Office of Public Health Preparedness and Response of the Puerto Rico Department of Health, where she has responsibility for the exercise programs for the hospital preparedness and public health preparedness programs. She's also a licensed medical technologist and has worked in the biological and chemical emergencies laboratories of the Puerto Rico Department of Health, responding to dengue, chikungunya, Zika, and other outbreaks and other emergencies. She's going to be talking to us today about the Puerto Rico Department of Health's response to Maria.
Thank you, everybody, for attending to this conference. Now, what I'm going to show you is basically an overview of the response of the Puerto Rico Department of Health to the different hurricanes. Like Miguel said, we not only had Maria on our spot, we were overcoming Irma. And usually people forget that after Irma, came Jose. Jose did not touch us, but it did go all the way to Florida. We're an island. So where does all of our merchandise and everything, all the support come from? Yep, you guessed it, from Florida by ships. So we did have a lapse of time in which we didn't have a lot of movement in our port for all the support that we might need in order for us to help our own people with Maria. For Irma, another thing that we had was that our public health system and our medical system, we were receiving patients from the Virgin Islands. We were actually providing them the care that they needed, and Puerto Rico Department of Health was actually the safe ground for dialysis patients. We were actually treating them in the island up until the exact day before Maria struck us. So then after giving them support, it came the time to actually support our people as well. So you will basically be seeing an overview of our response. Our response objectives, you have them on the board. These are the main ones. We did have about 12 full-on objectives throughout our response. Being the major one, trying to ensure the continuity of operations of our system, of the Puerto Rico Department of Health, so that we could actually support the healthcare systems around the island. Not only hospitals, as well as dialysis clinics, primary clinics, and also any type of healthcare facility, mental health, public health, that would actually provide the services to our people. So this is our emergency management structure. This is very emergency management based. But what I would like to point out is that this is the way that we function. We have in the middle, which is the heart of our operations, is a PRDH doc. The doc is our Departmental Operations Center. And what these people do is they collect all the information that we receive from the different regional EOCs, the Emergency Operations Centers. These are representatives from the Puerto Rico Department of Health in every single one of Puerto Rico emergency management zones. At the time, we had 12, so we actually had 24/7. We have personnel in each one of those 12 zones, as well as in the lower part where you see State EOC or the JFO, the Joint Field Office. We also had representation. That was actually where I was. And we were in direct contact with our ESF 8 partners, which were CDC as well as HHS. We were having direct contact and coordinating all the help that we needed according to the information that was actually collected at the dock. At your right, you will see the MOC. It's the Medical Operations Center. That was a center that was actually open to coordinate the transportation of patients into the USNS Comfort once we got that capability, as well as that coordination from doctor to doctor to present the cases to the boat, to the ship, to see if they were going to be accepted by the ship personnel. And upstairs we have the PRDH policy group. Our policy group is a group of all the secretary and his full-on right-hand staff. There you would find our environmental health specialist as well as our state epidemiology, and those are just part of the staff that we're dealing with public policy, public health policy, and how could we support the needs that we were collecting, the information that we were collecting from different communities. In terms of situational awareness, what you have here, and it is in Spanish because it is actually a picture of one of the reports, of the different reports that we were providing, that we would collect from the dock and provide to the federal government as well as to the state government. This was our dashboard. As you can see here, we were monitoring hospitals, CDTs, dialysis clinics, as well as primary clinics for people with mental disabilities. These were the main ones. This is not the full report. This was just the first pager in which they could actually see how many were operational, how many were fully operational, how many were partially operational, how many were closed, how many were on generators, how many were already connected to BRASA, to our water system, or were in cistern, so that we could actually coordinate from the Joint Field Office the list of here are our priorities. These are going to be your route in order to take them fuel, to provide them fuel, and make sure that those capabilities and those facilities did not have to shut down. Some of the medical missions that we were able to coordinate, you have them right here on the board. We had around 8 full medical missions that they went from Aguadilla. We had a health and medical task force, and they were responsible for providing different supplies to the other field medical missions. In different hospitals, we had DMAT teams, disaster medical assistance teams, that they actually had to pull up tents in front of the hospitals just to decompress the EDs. They would actually triage people who were coming into the hospitals. During a disaster, you may have a small clinic, but a lot of people would go straight into the hospital. So we would have a full compression into our EDs. That's where these personnel came in handy. They would triage people, provide primary care, and sometimes people would be able to be sent home with their medication at hand. Sometimes they had a prescription. If they did not have a medical insurance, no problem. With the help of the federal government, we were able to activate the EPAP program, in which people who did not have medical insurance were able to go to the pharmacy and actually get their prescriptions. In Humacao, on the Rico Memorial Hospital, we actually had to put in a combat field hospital. During Maria, their infrastructure was so weak that they were just about to shut down the hospital, but they were able to maintain their ED. So in order for them to maintain and sustain operations, a mobile field hospital was placed there. And what we did was that they would do triage, provide basic care, and if anyone needed specialized care from an emergency department, we would be able to coordinate transport to the nearest hospital. What you have here is actually a picture from the planning that we did for medical shelters, and this was with the help of HHS, our federal counterpart, and CDC. We actually planned ahead of time for 6 federal medical stations, and these were especially good for people who were in transition. They did not have the criteria to be hospitalized, but if they went home, they actually needed a little bit of extra care, and if the home care services were not able to get to their homes, these were the types of patients that we would be receiving. Planning for 6, we only had to open 2, which were the one in Manatee, right at the north of the island, and we had one in Ponce at the south of the island. Now, for a certain amount of time, there was one which you will see at your right hand that says pending, that says Bayamón Hospital Universitario. It was actually a medical shelter at a hospital. It was actually a full floor from the hospital that was prepared. It wasn't really used, but it was extremely useful as an option for Vieques dialysis patients whose clinic had been destroyed, and we were flying into the mainland for them to get their dialysis treatment. So at one point, they were offered the option to stay in the mainland, and we did